please welcome to the stage Dr. Margaret Mckenzie.
Break every chain, break every chain, break every chain. Come on, Timmy, say it. There is power. Good morning. Kalita, you're always a tough act to follow. And Dr. Seal is always putting me after you. But I'm going to take the challenge on. So first of all, I'm here in gratitude. I always feel like home when I've come here. And when that song, Lift Every Voice and Sing, played, I couldn't help myself because I got my start in a little AME church in Georgetown, Guyana. And I will tell you, I'm here because of being in that church. And every day when I wake up, I never forget it, but the song always brings such tears to my eyes. So we're going to switch gears a little bit. So there's a reason that Dr. Seal put sex at the end of the talk. It's important. It should have been the first topic at the beginning of the week because, frankly, I'm going to never be out of business, okay? But it's a taboo topic. And so today we're just going to approach it like you came into my office. And yes, guys come into my office with their women. And that we have to talk about it. So today we're talking a little bit about 4 areas. And those areas are how are you going to enhance your sex life and your sexual health? And we'll talk a little bit more about, even though as Kalita was finishing her talk today, we could have gone in many directions with that. But I just knew that I had to behave myself today, so I'm going to behave myself. But the first thing she says is that you've got to rest. And then she said you've got to slow down. And it turns out that in addressing our sexual health, those are things that are really critical. So there are some staggering statistics out there that will blow your mind. If you went on the internet, you'll see it. There are a couple TED Talks about it. And what it is not everybody is having sex that you think's having sex. And part of it is because we need to slow down. We've got the social media, we've got the internet, the email, and everything else is taking precedence. And that's something we have to address because it's important for our health. So the areas I'd like to talk about are performance, enjoyment, are you being effective in your sexual relations, and safety. Are your sexual relationships pain-free, physical, emotional, and so on, and how disease plays a role. So when we're talking a little bit about sexual health in my office, I've got a lot of couples who come into my office together. Many times it's the woman alone, but many times there are men who are just bold enough, they've had enough, and they're like, all right, Dr. Mckenzie, I'm coming because I want to be part of the conversation. And it's difficult to frame it because it's such a taboo topic. And I'll show you a simple way that I frame it. The first one is, what's going on in your blood vessels? Because blood is very important to go to your head and to go to all of your organs so that you can have an enhanced and happy sexual health. And so, are your blood vessels clear or are they clogged? If it is, it could affect everything from your mood to your sex drive. And again, blood flow to all of your vital organs that are involved in a great sexual experience. And things like your brain, your heart, your extremities, and your organs. So I would say if brain isn't going to one of these, it'll disrupt your sex life. And that's how we frame it. How about your belly? When you look down, can you see your toes? Okay. Trust me. Your belly is so important. And the reason is because What got you there, your waist to hip ratio, is what contributes to chronic disease, which contributes to your blood vessels not being optimally able to take blood to the important parts of your body that you need. Bet you never heard that one. And then third of all, what's going on with your sexual organs? Did somebody remove your ovaries prematurely? Did they overtreat you for prostate swelling or hypertrophy or prostate cancer? Were you overtreated? Did you get radiation? Did you take part in that? When they took your ovaries out, was there disease? Was there cancer in your ovaries? Or they just took them out because they were doing a hysterectomy for fibroids? And they thought, well, you're 40, we'll just go ahead and just take your ovaries out. So those are actually important because our hormones, again, help us with blood flow as well as helping our libidos. So if it's your blood vessels, if you've got heart disease, high blood pressure, diabetes, or if you've got mental health issues that actually will have you on either no medication but no psychotherapy, or you're in medication, all of those things can affect your performance. And the question is, how can you use food as medicine to really reverse that? And again, same thing with your belly. If you can't see your toes, you have to do something about it. So since I've lost the weight, it's been 11 years, which was provoked primarily because I have a host of women on my maternal side. Everybody gets diabetes at 50. And when you sit back and look at pictures of everybody's belly is out here. Now we're a family that's kind of strange because we don't have any hips. So no hips and a belly out here for us spells diabetes. So you need to know your family history because it's the ratio between your waist and your hips that'll determine the kind of chronic disease you'll get. And I found that it's easy, very easy for me to keep my weight off because I am a foodie, and all I need to pay attention to is this, what's going on around my waist. And I don't worry about the rest. Once you do that, it's amazing how that'll fall into place. So what you do in terms of what the food you eat and the timing of the food you eat, what you drink. Again, I was talking to Dr. Seal today about sugar. I think sugar is awesome because it enhances flavor, but we put too much in everything. And so it's amazing if you just remove sugary drinks from your diet, immediately the weight will fall off your waist. And then, of course, we have to move. And exercise isn't for everybody, but movement is critical for life. So you have to find something that you love to do and just do it and move. For me, it's I like jumping on a trampoline. Makes me feel like a kid, and it's easy for me. I could do it if I'm watching a show, or I could do it to be silly and twist my body, and as long as 15 minutes are up, I'm usually sweating, short of breath, didn't fall off, and I got my exercise in. When you're going to have surgery, if you've got a diagnosis, prostate cancer, prostate hypertrophy, if you've got an ovarian cyst, if you've got fibroids, if you've got dysplasia or precancer of the cervix, it's fairly common for us to get overtreated in our communities. So you've got to challenge your doctor and make sure you're not being overtreated, and you've got to make sure that you're your own advocate and look for a second opinion. Now, I'm going to branch into sexually transmitted diseases because it's something that our community deals with a little bit more than other communities. And it affects our feeling safe that we're not going to get something. So the data out there are 20 million new sexually transmitted infections in the US each year, 20 million. $16 billion is what it costs the healthcare system to take care of patients with the outcomes of these diseases. And now in 2017, we're starting to see more primary syphilis And also secondary syphilis, which can sometimes get to the brain and affect your heart and your blood vessels. And we're starting to see more among men. And it turns out because syphilis is a disease that's kind of quiet, but causes an opening in the skin of the genital area, it's actually a very easy way for HIV transmission to occur. So it increases your risk of HIV. The human papillomavirus, been around since Hippocrates' time. Now we know more about that virus than anything else. That virus is very easily passed sexually. It doesn't matter if you're a same-sex couple or if you're a heterosexual couple. We see it being passed and underreported, but carries with it an increased risk of oral cancer, cervical cancer, vulvar cancer, vaginal cancer, and anal cancer. In fact, it's the cancer that Farrah Fawcett died from. But everybody just said, oh, she died from that's the kind of cancer she died from. And so the bottom line is today, if you have that virus, you really need to make sure that you have a provider who's not just looking at the cervix for the disease, but that they are also sending you to get an oral check yearly, and they should also be doing swabs of the anus as well. All things we don't want to talk about, but critical and really can alter the outcome of your body. Hepatitis B and hepatitis C. How many people know there's now a cure for hepatitis C? So folks, for the ones who don't know, there's a cure for hepatitis C. It used to be just 1 or 2 types. Now it's actually more expensive. It costs about maybe $60,000 to $70,000 for a treatment. So when we talk about disparities, how many of us can afford to be cured? So you've got to be your own advocate. Look for clinical trials that you can get on. There are places where you can actually get free medication. Find those communities and make sure that you are getting cured, because it turns out that hepatitis B and hepatitis C are both linked to liver failure, cirrhosis, and liver cancer. And so those things are also important. There are also many cases of undiagnosed, the traditional 3, gonorrhea, chlamydia, and syphilis. Very underreported, because most of the time it's asymptomatic. And it turns out that 1 in 5 of us will just sort of heal ourselves and not have a consequence. But many of us will have a consequence. Stunning number, 2017, just reported. There were 461 newborns in the US born with syphilis. And in 2016, that number has risen to 628. Those are the ones that we know about. I just became the president of a hospital in a very broad community, and one of the things I just adopted is a very high infant mortality rate. That is unacceptable, and that has become my priority. But many cases where the babies would die in the first year of life, some of these cases are underreported because nobody's thinking of looking for syphilis. So the bottom line is we have to bring this message into the churches so that people can know that this data is out there and know at least that they should be screened. Chlamydia is the most common sexually transmitted disease in the world. In the US alone, there are 1.5 million cases that are reported. And based on the data from the CDC, it should be doubled. It should be about 3 million cases because it's very underreported. But chlamydia can affect your entire life in terms of your fertility. It causes pelvic infections, which then can cause you to lose your organs early, your ovaries and your tubes. It increases your risk of tubal pregnancies. Also, it increases the chance of your tubes being blocked. So when you're trying to get pregnant, then you can find out, oh my, your tubes are blocked and you can't get pregnant. So definitely underreported because nobody really speaks about it. I have two college daughters, and in as much as I don't want them having sex, I mean, no mother wants their kid having sex, right? Until we say so, which is never. And, as they were headed to college, this is something that I made them aware of. You know, you might think that, oh, maybe you can try it one time and you'll be okay, but that might be the one time you get it. And it turns out that on college campuses, it's the number one occurring sexually transmitted disease. Again, it causes pelvic inflammatory disease. It turns out that once the cells in your cervix are infected with this bacteria, it also increases your chances of getting HIV because the cells have a lot of inflammation and it's easier for HIV to penetrate your body. You've heard data that in many states now, pockets of HIV is increasing. We've got to manage that because the medication is very expensive and not available to everybody because of the health disparities. And then, of course, infertility. Let's talk a little bit about long term. So most of us think about STDs as, you know, you went to the doctor, you got treated, and then you're done. But I will tell you, the long-term outcomes include damage to your brain, yes. It includes damage to your heart and the blood vessels surrounding your heart, which means if it's affecting those blood vessels, it's affecting other blood vessels in your system. Things like chlamydia, syphilis is classic for that. Your oral cavity, cancers of your throat, the back of your throat. There's an increased incidence. We're seeing it in men over 50. There are certain cofactors. Smoking and drinking are things that can increase it. But in some patients, we talked a little bit about your epigenetic factors. There are other factors that we really don't know that are contributing to seeing the rise in this form of cancer. And the key thing is if you have the virus or if your partner has the virus, you need to know that, well, we should just, Dr. Mckenzie said, that if you're in this category, you should be getting your throat checked once a year. Because doctors today are busy, they have to see a lot of patients, and unless you bring up the conversation in the office, it's not happening. If you only see an internist, they're not even bringing up the conversation because they're seeing a patient every 15 minutes. And so you have to be your advocate and walk into the office knowing and not being ashamed of whatever history that you have that will affect your sex life. When you get a new partner, we tell patients, tell your new partner, so at least they'll know when they're coming into the relationship, the things they're at risk for. Again, we talked about it affecting your liver, hepatitis, B and C, both sexually transmitted, even though the common modes tend to be with blood transfusions. There are many couples who have hepatitis C, don't know how they got it, and most never had a transfusion. So that tells you the story there. We talked about the cervix, common. Every time the reason women get pap smears and they're doing HPV testing is because of cervical cancer screening. And last but not least, your genital organs. We just talked about the tubes, the ovaries, women losing their pelvic organs prematurely, and then also increasing your chances of infertility in the future. You guys can get all these slides as well. So there's all of this. What can we really do about it? Well, think about things of, I think that where the faith-based communities can help us is with bringing programming to your congregation, not necessarily just for young people, because we know, based on what's going on in Washington today, it's a reflection of what's going on in the country. We know that there are things happening in the church, and at least you don't make any judgment or any assumption that somebody might be immune. You come into this and say, you know what, we're going to be educating you. Once a month, we're going to bring in someone who can bring this information so that you can protect yourself. I am a product of a vaccination country because we never went to the doctor when I was a kid. Our vaccinations were free. They were part of the World Health Organization and the PAHO, the Pan American Health Organization program around the world. And so I believe in vaccination. Now, recently there has been a hubbub about, well, should I be vaccinating or not? And the questions that have been asked is, are vaccinations safe? I think the HPV vaccination is safe. I have the hepatitis B vaccination, and if they come out with a hepatitis C vaccination, I want that too. If I'm going out there in the world in a new relationship, because sometimes people have divorce or changing partners because of death, you need to get vaccinated. Because we've got older patients getting HIV and also the human papillomavirus. And when people come in, they want to know what's their risk going forward. So I'm here to tell you that if you're thinking about going out there, even if your doctor says to you, oh, we are only vaccinating between 9 and 24, I would tell you I would pay for it out of my pocket. Instead of getting your nails done and your hair done, I would get vaccinated. It's really worth it. Prophylaxis. No glove, no love. And also, if you know your partner has HIV, you can actually have prophylaxis available to you so that you will decrease your chances of getting the virus. So that's all I'm going to say. If you want to know more, ask me. And then the other thing we need to do is remove the barriers for testing and removing the stigma that's associated with who might have what and so forth. And there's a lot of stigma around homosexuality. I will tell you that I live a life of non-judgment. I think that judgment is for God, and it's not for us. And I think that we need to embrace every person who shows up at our front door, regardless of who they are, what they are, and how they live, and not judge them. Because if you live in a glass house, don't throw stones. We all live in glass houses. If you have a sister, a daughter, a niece, you never know what's going to show up. And you want your people being loved and embraced and not judged for what shows up in their lives. That's not why we're here. So we need to remove the barriers and the stigma. So again, early testing and screening is important, and treatment early for any kind of infections that we have. I believe in home monitoring. I think that everybody who's of color, I think and every person, regardless of color, who's over the age of 40, needs to own a blood pressure cuff. They're cheap at the drugstore. And if you know your family history, and even though you don't have diabetes currently, if your waist to your hip is actually much bigger and you can't see your toes, I think you should be checking your fasting blood sugar. That's what I tell my patients. That's what I do for my own life. And I used to be a pre-diabetic before I lost the weight. So again, weight loss will help you in that. But if you have it in your family, you should be checking your blood pressure and your blood sugar as well. And if you've got heart disease, you should be also plugged into a doctor. I think faith centers, how homes of faith should help us with this mission, because we should be bringing the programming to our spaces. In our space, we work with home and school. The schools in our district, we go into the schools and bring them this education because we know that many kids are not getting this education. And I think if you don't start very young and plant the seed, you're missing an opportunity to change. And so we're very open about it. We don't mince words. And again, recreational centers and libraries. So the biggest challenge right now that's facing the treatment and control of sexually transmitted diseases is actually we're seeing a lot of bacterial that we can't treat. So we've got antibiotics, but the bacteria is not being killed like it used to. And that comes from a couple of things. It probably comes from all viruses and bacteria, they want to survive. And they have a tendency to mutate and to become resistant to the drugs if you're exposed to them. But also, how many times have you had a bladder infection or a respiratory infection and the doctor gave you antibiotics and you didn't complete the course? As soon as you're feeling better, the last 2 days goes right? And so from that inadequate treatment, we are also seeing a lot of resistant organisms. So those are things that within your community, your church community, that you need to let people know. If the doctor gave you medicine, at least until, you should challenge how long you should be on it, but complete the course of therapy. If you, I think the message that we need to send in churches, we talked about this last year in my own church. There is a silence around sexuality that we're uncomfortable talking about it, even though everybody's doing it. And that silence has to stop. And the message needs to be that, you know what you are doing, but you don't know what your partner might be doing. And so the bottom line is, you have to talk about what are high-risk sexual behaviors and give people tools so that they can figure out how they're going to protect themselves. If we don't have the conversation, we're losing an opportunity. We are sexualizing the HPV vaccine and saying it's only for women. Well, it's usually passed back and forth between couples, same sex or heterosexual. So boys need to be having vaccinations. That conversation needs to start very early. And again, I would say, don't be afraid about vaccinating. I feel very comfortable with it. Like I said, if I was going out there in the world tomorrow, I would get the vaccination. And again, when you have people who are the high-risk groups, because of the silence, it's very hard to target them. So wrapping things up, in the future, within church spaces, within schools, within our communities, we need to really target the high-risk groups. 15 to 24-year-olds, that age group accounts for half of all the diseases that we see in this category. Men having sex with men, also very high group. We need to make sure that they're protected. And again, those who are receiving the antiviral therapies for HIV infection. And then we should be treating high-risk groups. Now, there's an organism out there called trichomonas that's very common. When women get it, they will come in with a yellow discharge that's kind of funny and a little bit uncomfortable, discomfort. So most doctors, whenever they treat women for trichomonas, they don't treat their partners. The partners need to be treated because trichomonas infection and chlamydia compromise the cells and makes it easy for HIV and hepatitis C to enter our bodies. So those are things that we need to do. And again, provide prophylaxis early. If you, and I'm gonna go to a very hard place. So we've had couples who've remarried because they lost a spouse. But because the couples are older, they're 60, 65 years old, there is no discussion about testing for these diseases. And we're having couples now finding out that both of them have HIV. So the bottom line is, if you happen to know you're going to marry somebody and you get screened, you really don't have to dump them. Because marriage is about love and I want to spend the rest of my life with you. But there's prophylaxis that could be provided to make sure that you don't get the disease. Very hard conversations, but important. There are 3 vaccines that are in the works. Chlamydia, they're looking for a vaccine right now. There's work that's going on with chlamydia, with gonorrhea, and with HIV. So vaccination's gonna help us. Think about all of us are high risk because as we age, because of our genetics, we're at increased risk for chronic diseases, high blood pressure, diabetes, heart disease. And the bottom line is you need to think about your blood vessels. Are they blocked or are they clear? What's your cholesterol? What's your waist to hip ratio? And again, if you have high blood pressure and diabetes, you need to be screened early and be treated and provide prophylaxis early. And again, I'm an advocate for second opinions regarding treatment for things like prostate cancer, fibroids. Should I leave my ovaries? Should I not? Last but not least, there's a whole other lecture, Dr. Seal, that has to do with vaginal dryness, vaginal pain, pain with intercourse, domestic violence, that we need to address in the future. Because we've got solutions as well that are non-hormonal, so many patients have breast cancer and, or have a strong family history or carry the gene, and they can't really take estrogen therapy. We've got non-hormonal treatments that are very effective. We use lasers in the vagina now that have been proven to improve the tissue so that women are able to have sex easily. There are lots of treatments now for impotence. The problem with impotence is that men don't like to talk about it, and they tend to hide because they don't want their partner to know that they might not be able to hold an erection. We've got treatments for those. Sometimes it's a little bit of psychotherapy, and also there are lots of techniques that we can use to get a man functioning again. And again, for second opinion advocacy, prevent overtreatment. Today, that's all I have for you because she just told me my time is up, but I'm available for questions afterwards. I'm around all afternoon. Thanks a lot.